tell us about your study and the findings.
Great. So we just finished the Bronx Mindfulness-Based Cognitive Therapy for Migraine trial. It was a trial that was conducted recruiting patients from the broader New York City area to evaluate the efficacy of an 8-week individual course of mindfulness-based cognitive therapy that is specific for migraine. Mindfulness is an attention regulation technique that involves non-judgmental awareness of the present moment. It's a somewhat challenging skill to learn, but once people learn it, it's something that they can apply to a variety of areas in their life. And our goal was to try to help people with migraine better manage their migraine through using this technique. We were able to randomize 60 people. 31 received the 8-week course of mindfulness-based cognitive therapy, and 29 were randomized to a wait list or treatment as usual group. After the 8 weeks of treatment, we then assessed them for a 1-month follow-up period, and we were able to look at changes over the course of treatment from a 1-month pre-treatment period to the follow-up 1-month period afterwards. The primary result is that headache-related disability was reduced in the mindfulness-based cognitive therapy group to a greater extent than in the treatment as usual group. And what's even more interesting is that we didn't see any reductions in headache days or in headache pain severity. So this treatment seems to somewhat specifically target headache-related disability, which is terribly interesting. It shows that patients can still experience some headache attack frequency while experiencing a reduction in disability, while going about their lives and being able to engage a little bit more in their daily life.
That is definitely an interesting finding. It's almost sort of paradoxical, but I guess it makes sense in a way, because they're still having the pain, but perhaps they reframed the way that they go about their day-to-day experience despite the pain?
That's exactly it. There are some processes that we hope change over the course of mindfulness-based cognitive therapy, and one of them is very important, called pain acceptance. And acceptance of pain sounds like a bad thing. We don't want our patients to accept an unacceptable condition, and we want them to get the most effective treatments possible. But when you are struggling with a chronic illness, there is a reality to the fact that this is a chronic illness that you suffer from, and you can withdraw from life, or you can try to engage in life as much as possible and to really run after valued activities. And that is what we are looking for people to improve with various mindfulness-based treatments, is this idea of being willing to engage with life in spite of chronic illness like migraine.
That's really, really interesting. So let me ask you this: a neurologist in practice, taking care of patients, who have various different neurological disorders, including headache or migraine. How do you, sort of suggest that they perhaps, get their patients engaged in these types of therapies, especially out in the community where it may be hard to access, experts like yourself and programs that you've developed? Absolutely.
There are a number of recommendations I would have around behavioral strategies broadly and how to incorporate into a neurology practice. The first is that we have several evidence-based behavior change or lifestyle strategies that reduce both days and disability and are good first choice for patients when they're considering preventive treatment options. It's ideal if you can actually combine it with the pharmacotherapy preventive options, and those include relaxation, biofeedback, or cognitive behavioral therapy strategies that target relevant behaviors to migraine, things like CBT for stress management or CBT for insomnia. My recommendations in those cases, when you're starting a new prevention regimen with patients, would actually not to be go to mindfulness first, but to start with these evidence-based practices. There are a variety of apps that can teach patients deep breathing or progressive muscle relaxation. These are evidence-based relaxations. And there are a number of therapists in most communities who are trained in cognitive behavioral therapy.